Good morning, ladies and gentlemen. I've been getting a lot of requests about people wanting me to help them with their pharmacology for the NCLEX. So I decided to put together a presentation. And so today we're going to talk about medication classifications by suffixes for the NCLEX. Okay? As you all know, my name is Annalise Garrison. My website is caringforyou.net. That's CARING, the number 4, YOU.net. If you go there, there's a lot of free resources you can get for the NCLEX, all the way up to $400. So there's free to $400 worth of stuff on my website. I've been helping students since 1997 with their NCLEX. So let me start out by saying this, that you're never going to be able to guess which drugs you will get on the NCLEX test. You're just not. So the best thing to do is to know the common suffixes, and that will give you a hint as to what type of drug classification it is. Once you know the classification, you want to answer based off of what you know about the specific drug classification, not necessarily the specific drug. This is the best way for you to know your drugs for the NCLEX, okay? I'm going to approach this presentation like this, okay? There are 5 main drug classifications that make the most revenue for the pharmaceutical companies. So, knowing this, I'm inclined to believe that the drugs that are on the NCLEX will be from these 5, but I'm going to put 6, okay, classifications that make the most money for the pharmaceutical companies. So my presentation will be based on this premise. All right? So, how am I going to go about teaching you about drug classifications? I'm going to tell you the suffix, then I'm going to tell you the classification of that drug. Then I'm going to tell you the purpose of those drugs in that classification. Then I'm going to tell you the common side effect for that classification, not this specific drug, but the classification. There's no way you can know the thousands of drugs that are out there, right? So I'm going to focus on 6 classifications. And why 6? Because I'm going to focus on the ones that make the most money for the pharmaceutical companies. These will be the drugs that are mostly distributed to our clients. So this is the way I'm going to attack this beast, okay? Very difficult. But I think if I do it this way, it'll make it simple and it'll be easier to understand. And then the last thing I'm going to talk about is not just the common side effects, but I'm also going to tell you the toxicity of the drug in its classification. And you want to make sure that you call the doctor. Usually for the NCLEX, the answer is not to call the doctor. But 3 out of 10 times, the answer is to call the doctor. And you want to call the doctor when you see the most critical side effects of a drug or the patient is experiencing drug toxicity. Otherwise, it'll be for the NCLEX, calling the doctor is not a correct choice, except to clarify a medication or to report a critical side effect or a medication overdose or toxicity of that drug, okay? So, when we approach the NCLEX and we don't know what the medication is, you've never heard of it, okay? Even if you don't know the medication, there are certain disease processes that are prevalent in the United States. For example, cardiac, obesity, high cholesterol, and diabetes, very prevalent in the United States. So if you don't know the drug, think, cardiac, could it be cardiac? Does it have anything to do with diabetes? Is it because of the person's obesity? High cholesterol is very common because people are obese or they eat the wrong things, right? So think about the world you live in when you come across a medication you don't know. Also, you want to remember other common medications such as respiratory, that has to do with the respiratory system, the flu, the virus, an infection, um, allergies, common meds like that, right? You also want to think about the world we live in. Okay, we live in a world that is very, very stressful. Okay, unemployment is high. 9/11 happened. We have a war going on in every country, it seems. So, because of this, you're going to have a lot of antidepressives, a lot of anti anxiety, and CNS depressants because of the world we live in, right? Unemployment, crime, 9/11, whatever that is, all right? So, and then, again, you want to remember that new medications come out every day. Think of what you see on TV. What medications are, I would say, trending at the time you take your exam? This may be on the NCLEX. For example, right now, I live in New Jersey. There's a lot of commercials for hormone replacement, testosterone, medication and sexual dysfunction medications like Viagra, right? And a lot of allergy meds, right? With the spring coming up. So think about that also when you come across a med that you don't know. So when you see these meds, ladies and gentlemen, you don't necessarily, oh my God, it's a medication, have to freak out. I've never seen this medication. I've never seen it either. But think of it logically. Think about the world you live in and think about the different classifications I'm going to talk about because I'm only going to talk about 6. And it is because of these meds are very high up on the revenue money that made the pharmaceutical companies made money off of. Think like this. Change your thinking. All right? Don't try to memorize the top 200 meds. Okay? Because by the time you take the NCLEX, the last 50 meds you just memorized have been replaced by the 50 meds that came out. Okay? While we were sleeping. All right? So it's an interesting and different way of thinking about this, right? Okay. Also, too, remember for the NCLEX that the NCLEX asks about, I would call street drugs. All right? So remember, too, that people self-medicate. And they do this because of the world we live in, unemployment, 9/11, crime, stress. Okay, so they self-medicate because we have lack of funds going on because people aren't working. And also, people don't have the right coping skills. All right? Not everybody goes to church. Not everybody reads the I Ching. Not every, so people don't have the right coping skills or they have lack of funds. Okay? So because of this, we're going to see perhaps alcohol usage on the NCLEX, so know the side effects of that. Street drugs, all right, such as heroin, cocaine, marijuana, etc. You may see that on the NCLEX. You will actually see prescription drugs on the streets. All right, so you have to be aware that people self-medicate even through prescription drugs. Either they have a prescription or they don't need it and sell it to their friends or whatever, right? And this is how prescription drugs get out on the street. Let me just share my opinion here, okay, as to why prescription drugs are so prevalent and get out on the streets. And by that I mean Percocet, Oxycontin, and Xanax will be the most prescribed medications that you see on the street. Why is this? Well, let's take my local community, for example. Okay? Uh, blank, blank, blank guidance center. Okay? You go to this guidance center. All right. You see a therapist, right? Now, the doctor will sit you down and say, don't share this medication if you'll be held legally responsible, blah, 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 right? So he makes out a prescription for, let's say, Xanax, okay? Which is a very common anti-anxiety drug. Or any med that he gives you, right? Well, how convenient in this same building there is a pain management center, okay? So you could go and say your back hurts or whatever and get your pain meds. Now you're going to get pain meds because pain is subjective. We have to go by what the person says, right? So in this same building, we have our psych doctor, right? Giving out the Xanax. We have the pain management center right next door, giving out the Percocets and the Oxycontins and whatever whatnot for lower back pain. And then, just out of another convenience, we have a pharmacy. So even if the people don't have a vehicle, don't drive, they don't need to drive. They take a bus, and then boom, they have everything they need at their fingertips. They have their Xanax, they have their Percocet, they have their pharmacy, back on the bus. Maybe they need it, maybe they don't. If they don't need it, they'll just sell it out on the street for $1 a pill, $5 a pill, whatever. So, be aware that this happens, okay? Also, if you work in the ER, somebody comes in, oh, I got pain in my stomach, I got pain in my stomach. Okay, I gave them 2 Tylenol, alright? Where's my Percocet? I got pain in my stomach, pain in my stomach. Sir, we don't give Percocet for pain in your stomach. So I go to the doctor, the ER doctor, and I say, Dr. So-and-so, I think we need to test so-and-so for drugs. Sure enough, he comes back positive for Percocet, cocaine, whatever he had in his system, okay? Testing for drugs is not a routine action we do in the ER. We usually just test the blood, complete metabolic panel, and we test the urine for urinary tract infection, blah, blah, blah. We don't test for drugs. But I only share this story here because you, as a nursing student, you don't know where, life's going to take you and where you're going to work. So be alert to your surroundings. If someone comes in complaining of pain and they know the name of that pain med and they weren't prescribed any, they didn't say they were on that, be alert that perhaps we need to do a drug test. Ask your doctor and he'll do it. Alright, not a problem. Alright, let me get back to my point here. So, on the NCLEX, let's know about alcohol, let's know about street drugs, let's know about prescription drugs that might get on the street. Also, people self-medicate. So, don't forget your herbal supplements. A lot of your herbs that would alter the CNS, such as Stress X, for example, valerian root, these are all, okay, Stress X is for anxiety, valerian root is for sleeping, and then St. John's worts is for depression. Those are examples of herbal supplements, legal herbal supplements, that people may self-medicate with. So be aware of that. You also want to think about your nutritional herbs, okay, because if these nutritional herbs are taken in overabundance, all right, for homeopathic reasons. But we don't want to forget that even nutritional herbs and people that mean to do well, okay, these can also alter the body's natural homeostasis of fluid, electrolytes, and minerals. Alright, so don't forget to ask about your nutritional herbs and your herbal supplements, as well as prescription drugs, as well as street drugs and alcohol, but they won't admit to the street drugs and the alcohol, okay? They may admit to the prescription drugs, okay? And also be aware they may be taking prescription drugs and not have a prescription. Alright, that happens a lot too. That's the whole purpose of my sermon. But, alright, enough of that. Let's carry on, all right? Today, The only classification I'm going to talk about is adrenergic drugs. Adrenergic drugs, okay? The suffix of these adrenergic drugs end in OL and INE. I said there were 5 main classifications, but because cardiac disease is so prevalent in our society, and it also makes a lot of money for the pharmaceutical companies, I'm going to put beta blockers separately. Alright, so adrenergic drugs are stimulant drugs. The suffix for all adrenergic drugs are OL or INE. Write that down. Alright? Again, talking just about the classification. It's your job to look on the NCLEX and put the specific drug in the specific classifications. I'm just going to open your eyes. I'm just going to guide you a little bit and talk about the classification of these drugs. So adrenergic amines are drugs that stimulate the sympathetic nervous system. Okay? The sympathetic nervous system is part of the autonomic nervous system that originates in the thoracic or chest and lumbar or lower back regions of the spinal cord and regulates involuntary reactions to stress. It stimulates the heartbeat, sweating, breathing rate, and other stress-related body processes. All right, that's about the classification of these drugs. So, what is the purpose of adrenergic drugs or stimulants? Okay, remember that the suffix is what? OL and INE. Now, let me just say here that we have to be careful with the drugs ending in OL. Anything that ends in OL has an alcohol compound in it called hydroxyl. Hydroxyl, OH, is an alcohol compound. So we want to make sure that the patient doesn't drink anything when on these medications. Okay? Because hydroxyl, OH, is an alcohol compound, and anything ending in OL has OH or hydroxyl in it. Alright, but the overall purpose of adrenergic drugs is to increase the output of the heart. This makes sense, right? It's a stimulant. Or it may raise the blood pressure. Makes sense. Adrenergic drugs are stimulants. They may increase the urine flow. They're also responsible for vasoconstriction. All right, this is the ability to make blood vessels constrict. The ability to make blood vessels constrict makes adrenergics useful in reducing nasal stiffness associated with colds and allergies. And then, of course, we have our bronchodilators, all right? They're stimulants, right? Okay? They're used, of course, to treat asthma and chronic obstructive pulmonary disease, right? So this is the purpose of adrenergic drugs that are stimulants. And remember what I said about the OL and the hydroxyl, which is an alcohol compound. Bet you didn't know that. Quite interesting, isn't it? It's quite interesting when you learn about drugs this way, instead of sitting down, oh, what is the side effect for this specific drug, blah, 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 you know? Think about the whole classification, just the classification in general, all right? Then plug in the drug in these 5 classifications. Again, we'll talk about beta blockers separately, since that's so prevalent in the United States, heart disease, okay? So let me give you an example of some common drugs. We have our albuterol, okay? Albuterol, right? Such as alupent, Ventolin, and others. These are given by mouth or as a nasal spray to do what? To improve breathing. It's a stimulant, right? Then we have our dobutamine. Even I have a hard time pronouncing these drugs, right? But for example, this dobutamine is used to stimulate the heart during surgery or after a heart attack or cardiac arrest. Again, an adrenergic drug stimulant. Then we have dopamine or entropine. Okay, this is used to increase cardiac output, blood pressure, and urinary flow in treating patients mostly with shock. Okay, but you can give dopamine for other various things. Usually they don't have to be in shock for the NCLEX. You can be taking an IV of entropine. What would be important for the nurse to follow up? You know, so everything I say here is not exclusive to what is here. You know, but it's interesting, and I enjoyed putting this presentation together. That's for sure. Um, Then we have what? Of course, our epinephrine or our adrenaline, right? This is usually used locally to control bleeding from the areolas and capillaries during surgery. It is used to treat shock, or it's used as a heart stimulant and as a decongestant. Epinephrine may be added to local anesthetics to keep the anesthetic in the area where it is applied. Epinephrine may also be applied to the eye to reduce the symptoms of conjunctivitis. What's conjunctivitis? Pink eye. And I'm telling you right now, if you see conjunctivitis on the NCLEX, it does not get a private room. Airborne gets a private room, not conjunctivitis. Conjunctivitis is droplet, right? Or contact, right? Contact, sorry, not droplet. What am I thinking about? It drops out of my eye, but someone else comes along, touches me or rubs wherever my teardrop fell, so it's contact. But anyway, I'm digressing. Then we have our isoproteranol, isoproteranol. This is most widely used to ease breathing problems in asthma and COPD, but also used to control several types of irregular heartbeats until a pacemaker can be implanted. Now, I'm only using a couple of drugs here to prove my point. Just when you see an OL medication or a medication ending in INE, put it in your adrenergic drug classification category. We have our phenylephrine or neosynephrine. Neosynephrine is used to treat shock and low blood pressure, also used in the form of nose drops or spray to relieve nasal congestion from colds and allergies. We have our aramine or our metaraminol or aramine, right? This is used to raise the blood pressure and stimulate the heart in treating patients with shock. And then we have our norepinephrine, and this is used to increase the output of the heart and to raise blood pressure as part of the treatment of shock. Again, it doesn't have to be shock. I'm just, giving you common drugs and common reasons. But it's your job to get that drug and insert it in the correct classification, of which I'm only going to talk about 5, and I'll put beta blockers in a separate one. So, for this entire classification of drugs, ladies and gentlemen, not specific drugs, for this entire classification of drugs, what are the common side effects? Okay, common side effects of these types of drugs can be nervousness, agitation, wakefulness. These side effects do not usually cause problems when the drugs are given during surgery or in combination with local anesthetics. All right? The following side effects sometimes occur when adrenergic amines are used to treat nasal congestion due to allergies or infections. And that is a rapid heartbeat, increased swelling, nervousness, hallucinations, sleep disturbances, paleness. Why? Because these are adrenergic drugs. Adrenergic drugs are stimulants. What we want to be aware of and what we want to call the doctor about is if we see signs of toxicity. And what are signs of toxicity with these drugs? Okay, the symptoms are similar to those of amphetamines, such as cocaine or caffeine overdoses, right? Which makes sense. Again, it's a stimulant. Okay? Massive overstimulation of the central nervous system results in a state of hyperkinetic movement and unpredictable mental status. The patient may become easily enraged or alternatively suicidal, but mania is a typical reaction. So, if you see signs of toxicity with these types of drugs, this is when you want to call the doctor. Otherwise, calling the doctor on the NCLEX is not the answer unless it's a critical side effect, extremely unusual side effect, or a sign of toxicity. Physical symptoms are more serious and include things like heart arrhythmias as well as outright heart attack or stroke in people who are at risk for coronary disease. Breathing is rapid and shallow while both pulse and blood pressure are dangerously elevated. So, when you see the signs of toxicity for the classification of adrenergic drugs, which are stimulants, this is when you want to call the doctor. So, today we discussed adrenergic drugs. It's a short discussion. I want to break up this discussions into the different sections. So this is all I'm going to talk about today. What I do want you to realize, and I'll talk about this the next recording that I put up here for you, we're going to have a problem here because adrenergic drugs end in, what did I say? OL and INE. But all antihistamine drugs end in INE. So we're either going to have to commit to memory or I'll come up with some way, but just be aware that both antihistamine drugs and adrenergic drugs end in OL and INE. But really, well, your antihistamines end in INE. Your adrenergic drugs end in INE and OL. So just commit this to memory. If I come up with a mnemonic or some way or some concept, I'll let you know. All right? This is all I want to talk about today, and I hope you find this helpful. And if you do find it helpful, I want you either to go to my website and write a review, all right, that you're using my stuff for free, you haven't taken the NCLEX yet. Give me some feedback so I can help you. All right? If I'm not making sense, I need to know that too. So if you could go to my website, caringforyou.net, CARING, the number 4, YOU.net, and click on the link that I have where it says write a review. Could you please write a review and tell me how I'm doing? I want to bring you the best product, whether you're paying $400 for it or whether it's free. I need to have my website up to date and good to go for you. So today we discussed adrenergic drugs. Next time we're going to discuss antihistamines, and we'll take it from there. All right, good luck on your NCLEX. Looking forward to hearing from you either through a review or an email or something. All right, guys, good luck on your studies. And until next time, this is Annalise Garrison, and I'll talk to you later. Bye-bye.